According to the American Heart Association, cardiovascular disease kills nearly 1 in 3 women each year. That's about 1 woman every 80 seconds. Dr. John Forcella from Florida Hospital is here to help women learn how to take control of their heart. Good morning.
Good morning.
I know I've talked about this before, but when you see these statistics, it's still shocking. I cannot believe that. And we were talking about compared to breast cancer, which I feel a lot of women, even men, are more apt to talk about that. This is a huge issue.
It is. Like you talk about breast cancer, usually kills about 1 in 31 women.
Okay.
When we talk about cardiovascular disease, it's 1 in 3.
1 in 3. So let's get to some of these issues of why this is such a big problem. What are some of the risk factors that we can control?
Yeah, absolutely. There's several different risk factors, and some things that we can control is knowing our numbers. Okay, and certain numbers that we should be aware of is our blood pressure, our weight, okay, and being a healthy weight.
Okay.
Knowing with our cholesterol, our LDL, okay, our total cholesterol, our HDL, which is our good cholesterol, our blood sugar levels. So these are things that we should know.
Are these things that are routinely being checked with our normal physician? Do we need to ask about these numbers? What can we do better? Because obviously these numbers are saying we're not doing enough.
Absolutely. No, these numbers should be checked on a routine basis with our primary care physicians.
Okay. Yearly basis, do you think? Or more often or less often? What do you suggest?
On every visit, at least on a yearly basis. But we should be monitoring certain things more frequently ourselves.
Okay.
When we're talking about our body mass index with our weight, okay, and then doing other things with healthy exercise, okay, not having a sedentary lifestyle, and healthy eating habits.
Is there a certain age where women really need to start paying attention to these numbers?
From right away.
Right away. All right. So young?
Right. Yeah, absolutely, because our healthy eating habits, our lifestyle habits start when we're younger, and that will carry in to when we become older. So absolutely.
Let's talk about maybe some of the risk factors maybe we can't control. Is this hereditary? If we know that mom or grandma or sisters have had issues, do we need to be watching this more often?
Absolutely. If you have a first-degree relative, mother, father, siblings that have been diagnosed with heart disease, especially at a younger age, you should be more aware of that and be evaluated. Okay.
Is it easy to kind of look out for symptoms and for red flag warnings? I mean, what are some of those things that may go, you know what, we need to pay attention to this more?
Sure, absolutely. Now, of course, the most common symptom of someone having a heart problem or a heart attack is chest pain. However, a lot of women might not have these classic symptoms. So some symptoms that you need to be aware about is arm pain, back pain, jaw pain, cold sweats, nausea, or extreme fatigue. But the key is, if you're just not feeling yourself, and symptoms have changed, you're not feeling right, is to be evaluated.
You need to be your own health advocate. As much as we love our doctors and our physicians, I mean, you really need to make sure that you're staying, no one's going to do it better than yourself, correct?
Absolutely.
What's your take home as we kind of wrap up, and what do you really want to make sure that women know? And I think even partners, making sure that the husbands say, hey, are you on top of this? Are we making sure that we're...
Sure. A big key is know your numbers. So you should be knowing your numbers, know what your cholesterol levels are, your HDL, your LDL, your total cholesterol, know your body mass index, okay, know your blood sugar levels, and know these things, okay? And have a healthy lifestyle with being healthy eating habits, with a healthy diet, and a healthy exercise program where you're not having a sedentary lifestyle.
When you look at the future of this, do you see that the numbers hopefully will get better? I mean, are we going in the right direction, do you think?
Absolutely. As we educate more and become more aware of the issue, then things will improve. Absolutely.
Okay. Doctor, thank you so much for being here this morning. Again, 1 in 3 women are going to unfortunately die this year because of this. Hopefully we can change those numbers sooner rather than later. Thank you, Doctor. We appreciate it.